Good evening, everyone. In the series of classes related to infertility, one of the class that will be today is of causes of infertility. So continuing with the class, infertility is referred to couple that has failed to conceive after 12 months of regular sexual intercourse without the use of any contraception. And infertility can be due to the woman or man or both. Primary infertility is something where the couple has never conceived. 1/3 of the infertility is due to male partners and 1/3 is because of female partner. The remaining of it is because of idiopathic reasons. And so major causes of infertility includes the male partner's defect, female partner's defect, and the idiopathic causes. Some general causes of infertility are environmental factors, toxic effects of tobacco, smoking, alcohol, drinking, or other drugs. Then excessive exercise, inadequate diet, and advanced age are also some of the causes of infertility. Some other causes, the causes has been summarized like this, like congenital or developmental factors, hormonal factors, tubal or peritoneal factors, and uterine factors. The congenital or development factors include the abnormal external genitals, the absence of internal reproductive structures. Then hormonal factors include anovulation, which could be primary. Then pituitary or hypothalamic hormone disorders, adrenal gland disorder, congenital adrenal hyperplasia, anovulatory, which could that is secondary, maybe because of disruption of hypothalamo-pituitary ovarian axis, early menopause, amenorrhea after discontinuing of oral contraceptive pills, or increased prolactin levels. The tubal or peritoneal factors include absence of fimbriated end of the tube, or absence of a tube inflammation within the tube, absence of the tube, or absence of inflammation of tube. And then tubal motility is sometimes reduced, or there could be tubal adhesions. Then uterine developmental anomalies or endometrial and myometrial tumors and Escherman syndrome can also lead to female infertility. Here, this diagram has summarized these factors in a very beautiful way. Here you can see the uterine factors, which are responsible for 10% of cases, include the chronic endometriosis, fibroid, synecdoche, and congenital malformations. The cervical factors, which contribute to 5% of infertility, include ineffective sperm penetration, chronic cervicitis, immunological factor, that is the presence of anti-sperm antibodies. Then 30 to 40% causes of infertility is because of ovary. And most of the times the dysovulatory functions are responsible, the anovulation and corpus luteal insufficiency, which could lead to recurrent abortions. The tubal factors, which are responsible for 25 to 35% cases, it may be because of tubal infection or pelvic endometriosis. Then altered tubal motility could be the cause, and other pelvic causes include endometriosis and adhesions, resulting in kinking of the tubes that might disfavor the traveling of the fertilized ovum or the sperm. The major causes that are responsible for female infertility are defective ovulation, defective transport of the ovum, or defective implantation of the fertilized zygote. Then congenital developmental factors like absence of vagina, vulval agenesis, uterine malformations, fallopian tube, and ovarian causes. The defective ovulation occurs due to either endocrine disorders or the physical disorders. This is the diagram showing the polycystic ovarian diseased ovary. A polycystic ovary. Here you can see the normal ovary, the primordial follicle is developing in a proper manner, while in polycystic ovary, where there are a lot many follicles arranged in periphery, and the follicles are not selected properly for growth. Here you can see this is the cause for polycystic anovulation, and chronic anovulation occurs in polycystic ovarian syndrome. In endometriosis, also there could be lot many inflammatory factors that may result into defective ovum, and it results in this infertility. And inflamed uterus or inflamed fallopian tube or ovary may result into the infertility. If it may be because of defective transport mostly. Then there could be implantation defect, which can be because of uterine fibroids.